Hello and welcome. It's 11 a.m. here in Seoul. I'm Choi Jung-yun at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Yoon Tae-ho, the Overall Officer of Disinfection at the Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in the country. He will fill us in on the number of new infections as of midnight and the efforts that the government is making to contain the virus. To give you a brief idea as we wait, South Korea reported 672 new cases of COVID-19 on Friday. 652 of Friday's total cases were local transmissions and 21 were from overseas. Health officials are closely watching the situation and they have been saying recent infection signal an urgent crisis. Now let's take a look at the briefing.
코로나19 대응 방안 등을 설명하겠습니다.
4월 16일
Let us now begin our regular briefing for April 16th, Thursday. As of today midnight, we have 652 new local infections and 21 imported cases. Currently, we have 111 patients with critical or severe symptoms, which is about 1.4% of the patients who are under quarantine. And we have about 614 hospital beds available for the intensive care units. And also, we have about 9,000 hospital beds available for patients with mild or moderate symptoms. Yesterday, we had 2 additional fatalities, and I extend my deepest condolences to the deceased and the members of the bereaved families. In the metropolitan area, we recorded 442 cases, and they hovered around and they were infected at these day-to-day facilities, especially at the indoor sports facilities, workplaces, schools, and restaurants and cafes and so forth. And we believe that at any places we can be prone to the exposure to the risks of COVID-19 infections. And currently we are not elevating our social distancing level. However, we believe that the most effective measure of containment is right now to comply stringently with the quarantine measures during our day-to-day routines and also minimize physical contact. It is also advised for you to reduce and also cancel any of the non-essential meetings or outings, and also wear your face mask at all times. Moreover, if you have any suspected symptoms of COVID-19 like coughing, fever, or muscle pain, we ask you to refrain from going to workplaces or also refrain from going to multi-use facilities and get tested as soon as possible. We believe that when the government's efforts are met with the public's efforts, we can also contain the virus to a large extent. Currently, we have seen many people with symptoms of visiting the multi-use facilities or going to work. And also during the month of March, we have seen the cluster infections, and we have seen people who had symptoms for over 3 days, but they did not get tested. And these numbers amount to about 55% of the latest cases. And we believe that a majority of the cases were due to the delay in identifying the index patients. And to this end, we would like to put in an administrative order for the metropolitan area in the Seoul City and Incheon and Gyeonggi-do province, as well as Busan, to get all of the people to test it with symptoms to get tested. And currently, we have 11 local governments who are having the administrative orders for those to have the mandatory testings for anyone with symptoms. So if you have any symptoms of COVID-19, and if you have been recommended by a doctor or a pharmacist, you need to get your tests within the next 48 hours. If you fail to comply with these measures, please note that you will be subject to penalties and fines, and you will also be eradicated of these incentives and also treatment costs when you are infected with COVID-19. And also after infection and after you spread the virus to others, please note note that you could also be subject to the indemnification clause. So this is to protect the safety of your family members and also the rest of the people in the local community. Looking at the cases in the Sejong city, one person had tested as soon as possible, and he or she was tested and immediately after showing fever, and also returned home immediately. And this person also reduced the local transmissions as well. So it is also important to note that if you have any symptoms, you need to get tested as soon as possible. And the government will also continue to exert effective measures to contain the virus spread going forward. And at the screening centers in the community health centers, we are also providing free testings for anyone with symptoms or even without symptoms. And as for these people who are being recommended by the doctors and pharmacists, we are also streamlining these procedures so that they can get tested more easily, and these detailed guidelines will be provided to you as well. And we ask for your support going forward, and we ask the support of the medical professionals going forward as well. And we also need to explain to you about the quarantine measures for the retail industry, including the delivery services. And please note that these workplaces are prone to cluster infections. And we have seen similar cases in January and March. And due to a lack of face mask wearing rules and also lack of social distancing measures, they also had seen a large cluster infections. To this end, the government ministries are continuing to carry out pan-government efforts to carry out regular quarantine measures inspections, that is, on a regular basis and on a weekly basis as well. And we also would like to continue to intensify and bolster our quarantine measures for these delivery services going further. And most of the public, I see that they are complying well with the quarantine measures. However, at certain spaces and facilities, they are breaching these measures, which is leading to cluster infections. As we noted during the briefing on the 12th of April, we are also exerting our full efforts to carry out a pan-government inspection for the virus vulnerable facilities. And this pan-government efforts task force constitutes of the central government ministries and local governments, as well as the police agency. And we have a total of 7 task force teams. And they will be looking at the cram schools, religious facilities, indoor sports facilities, and also nightlife entertainment venues, preschools, and also restaurants and cafes, and so forth. And they will be looking at the 9 types of facilities that are prone to virus infections. And they will be looking into whether these facilities comply with the quarantine measures, and if there are any breaches, they will also make sure that these places are subject to penalties and fines. And once again, we would like to extend our deepest appreciation to all of the people who are exerting their full efforts to participate in our quarantine measures. And every Saturday, starting from now on, we will also have the on-site inspection rather than our previous and conventional meetings. And we will be focusing on the infections monitoring on these sites. And we will also be looking at the cluster infections stemming from the multi-use facilities. And in particular, we will be looking at these facilities like restaurants, singing rooms, cafes, and so forth, which have also eased the operation hours. And at these facilities, we are also having a big trust in the managers in that they will carry out voluntary quarantine measures. However, if such cluster infections stem from these multi-use facilities going forward, we will also make sure that we need to elevate the social distancing measures, and this will also inevitably enable you to face some economical disadvantages. So once again, we would like to ask you to comply stringently with the basic quarantine measures for the sake of your health and those of others around you. And the government will also exert our full efforts to enable you to return to a state of normalcy as soon as possible. Thank you very much.
That was a government briefing on the COVID-19 situation here in the country. South Korea reported 673 new COVID-19 cases on Friday, and this brings the accumulated number of cases to 112,789. There have been 2 more deaths, raising the death toll to 1,790. We'll have the coverage here, but we'll be back at 12 p.m. Korea time for our midday news with Mark Broom. Bye for now.